If you're not performing socket preservation after a tooth extraction, you're bound to have bone loss. Hi, I'm Dr. Isaac Tawil. Today, we're going to discuss socket preservation and why it's a crucial step in extraction and implantation workflow. We're going to keep things simple, so you don't need to be a doctor. Follow along. What happens after we extract a tooth, or if a tooth is missing for a period of time? We have different jawbone types. We have alveolar bone, and then we have basal bone. When we extract a tooth, the alveolar bone starts to shrink. It starts to remodel. What ends up remaining is some limited amount of alveolar bone, and typically what's left is mostly basal bone, which is insufficient bone for restorations, if we're thinking about restoring with some type of a future restoration. So how do we prevent alveolar remodeling? The first is technique sensitive. We need a technique that is mitigated by a minimally traumatic extraction. The second part, which would be based off of socket preservation. So what is socket preservation? When a tooth is extracted, it leaves behind an empty socket in the alveolar bone, leaving behind mostly basal bone. Socket preservation is a procedure that involves placing bone graft material into the empty socket immediately after the tooth is removed. This helps maintain the bone volume and structure of the alveolar bone, which is essential for future dental work like implants, fixed prosthetic dentures, such as bridge work, or even well-fitting removable dentures. That's right, even removable dentures would require some foundation to fit properly so that dentures aren't flying out of people's mouths as they chew or as they speak. So why do we need to fill every socket? What happens if we don't? If a socket is left unfilled, the surrounding bone begins to resorb or shrink. This can lead to several issues. Compromised bone structure. Insufficient bone can make it challenging to place dental implants, can require more complex procedures to rebuild the bone. We have aesthetic concerns. Bone loss can affect contour of the gums and jaw, leading to aesthetic issues and potentially impacting the patient's confidence. Functional problems. Missing bone can lead to shifting of adjacent teeth and bite problems, and difficulty in fitting dentures or bridges. By filling every socket with bone graft, we can preserve the bone structure, maintain the aesthetic appearance, and ensure better functionality. This protective approach not only benefits the patient's oral health, but also makes any future dental treatments much simpler, much more effective. Thank you for joining me today to learn about the importance of socket preservation. If you have any questions or need more information, please feel free to reach out. Until next time, take care and keep smiling.